can be the greatest, you can be the best. You can be the kid calm banging on your chest. You can beat the world, you can beat the war. Got the guy go banging on his door. You can turn your hands up, you can beat the cop. You can move a mountain, you can break rocks. You can be a master, don't wait for luck. Dedicate yourself and you can find yourself. Standing in the hall of fame. And the world's gonna know your name. You can walk straight through hell with a smile. You could be a hero, you could go breaking over with the sleep under the cookie bowl. Do it for your people, do it for your pride. Look on the road, never even try. Do it for your country, do it for your name. Cause there's gonna be a day when you're standing in the hall of fame. And the world's gonna know your name.
So good evening, welcome you all to the launch of GKS Master Technique and Active Athlete. So first we will be launching GKS Master Technique. So I would like to just introduce the founder of GKS Master Technique, Dr. Gopa Kumar. He is the founder and CEO for Physio, founder and academician, CAS, founder of GKS Master Technique, founder of and editor-chief of Active Athlete, senior sports physiotherapist, and 25 years of experience in this field. I request Dr. Gopakumar to speak a few words about the same.
Hi everyone. It's a proud evening today to have all of us together. I welcome every speakers, instructors of different expertise for today's evening and this event. I would like to introduce, as I said, I'm the CEO of CAS and Core Physio. Yes, before I just get in a precise, I don't want to make it elaborate because we have the guest speakers and the other instructors here who's going to be speaking about few words. So it's just GKS Master Technique. It's just basically a dream come true where I wanted to launch it much before, and due to this pandemic, it got delayed. And yes, we worked much more structured, couple of things. So the whole GKS Master Technique is about learning. So learning doesn't stop you. So sitting up and with my whole experience of my teaching and work experience, I put a lot of things together and structured out. Why don't we have every techniques put into under one roof, and with expertise, with experts especially, together working on this and giving much more better experience of learning. So that's where GK's Master Technique came in, where we wanted to work on different kind of techniques, different kind of specialized techniques. To know this, we need to understand anatomy, we need to understand biomechanics, the analysis, we need to know what are the different kind of techniques that can help you out in the enhancement of recovery. And that's where I structured out a couple of contents for people to learn, and this would be beneficial for all to come in with live workshops. So this GKS Master Technique is basically with the live workshops, which is going to be starting from 2021 Jan. And before that, we wanted to launch and give information to everyone about this technique. So we have all of the instructors on board, and they would be giving us the information on it. Thanks a lot, and let's looking forward to get this technique on board and teach as many professionals to become practitioners, well practitioners with different specialized techniques. So let's move forward. Thank you, thank you, thank you.
Thank you, Dr. Gopakumar. I would like to introduce Dr. Anil John. He is an advisor and chief instructor of GKS Mastertechnique. He is the principal of College of Physiotherapy, School of Health Sciences, Dayananda Sagar University. I request Dr. Anil John to speak a few words.
Raju, can I join you another 2 minutes? If you don't mind, we will just proceed with the next. I'll just talk after the next speaker.
Yeah, no issues, Dr.
Yeah,
Anil.
yes. Please.
So now we'll go move on to the international speaker. Our guest speaker is Andy Champion. He's the founder president of the Inverter Belt and the physical therapist at OSF Healthcare. I request Andy Champion to speak few words about your expertise and please, I request Dr. Andy Champion.
Well, first, thank you for having me here. Very exciting to be here and to see all of this collaboration. It's great to see bright minds getting together and making things better for our profession and moving our profession forward. So very exciting times. I'm going to try to share my screen here. I'm going to warn you guys that I'm not the most technically sound person. So I'm going to try to share my screen so I can get a quick little PowerPoint just to show you kind of the inverter belt system and everything that kind of goes into it. It looks like I'm being blocked to share my screen. I don't know if the host, whoever's hosting, can unlock
Yeah,
that.
one
Is that
second. I will allow you to do that. 1 second, just a second.
okay? Thank you. Can everybody hear me okay?
Yes, yes,
Still
yes.
unclear.
I think you
Excellent.
can do it, Andy, right now. Just try it out.
Oh. All right, can you all see my screen there?
Yes.
Yes,
All right,
Andy.
great.
Yes, Andy.
So the inverter belt system is really a system that I created to help really bridge the gap between the traditional therapy that we see in the clinic, manual therapy techniques, whether it's overpressure, mobilization, et cetera, and allow individuals to try to create some of this manual therapy technique on their own. Little background on me. Obviously, I'm a physical therapist. I've been working for 13 years, managed clinics. I've been the director of the spine clinical specialty team for the regional hospital. I'm OCS certified. I've taught multiple spine courses in the United States. I'm the founder of the Oakford Group, which is, again, a company that helps to produce physical therapy products, intuitive physical therapy products. And then I am also the co-founder of DIY Therapy, which is a company that is designed for self-efficacy for patients, helping people become more aware of symptom recognition and treatment strategies that they can use and on their own, and basically an education hub and a resource for individuals who are trying to help themselves, which is really what my big focus in the clinic has always been. So the inverter belt system is, as I kind of mentioned earlier, is really designed to help bridge the gap between the clinical treatment that exists and the home treatment, allowing individuals to have mobilizations being applied to their spine multiple times a day versus 1, 2, 3 times a week. In the United States, we have a treatment practice where we are seeing patients less and less and less in the clinic. Times are being shrunk because of insurance purposes. And so there's starting to become this gap that's being created between the actual clinic and home home treatment and home exercise programs. So the inverter belt is designed to help decrease the costs overall, decrease reoccurrence rate, which is a huge issue in the United States. We have a 58% reoccurrence rate in regards to low back pain, and then also just increase outcomes, improve people's quality of lives, et cetera. It's comprehensive. It's based upon the treatment-based classification system and the clinical prediction rules. It really utilizes specific exercise, directional preference, McKenzie method, mobilizations. It works with instability for strengthening, and then provides a bit of traction, then also helps with posture and posture awareness and soft tissue mobilization, both for nerves and say muscle, etc. Really the bread and butter for the inverter belt system is where it combines directional preference, McKenzie method type of exercises with overpressure and mobilization. So the clinical overpressure and mobilizations between grades 1 and 4 can now be applied for individuals at their home once it is taught to the patient via the clinician in their clinic. And so this helps to continue to allow the patient to have really quality care at home and get the actual needs that they need repetitively throughout the week, throughout the day, versus 1 to 2 times a week or a couple times a month, whatever the current schedule is for the patient to return to the clinic. I'm going to go through several different just pictures. And actually, I'll back up here. This is just a picture of the belt. It's a very simple belt. There's a strap that goes around the waist. There's a foot harness that then connects to the foot, and then there are resistant bands that actually connect to the belt itself, which allows for some different activities and exercises to be performed, and allows a ton of versatility, which is really part of the reason why we've had so much success in the States here with this. But as you can see here, this is kind of the very first progression. This would be just a simple overpressure. The belt is around the segments of the spine that you would be looking to provide that overpressure with. Because the individual is holding on to the resistant bands, the yellow straps, it's providing a upward force towards the head, and then the foot is actually being braced and stabilized through the foot harness, which is wrapped around the foot. And that creates a force that is posterior, anterior to the spinal segments. So this would be just the very, imagine somebody being very acute and needing just a little bit of overpressure, getting into, has a directional preference of extension and needs to get into just some positional relief here. This is an excellent technique for that. We can see here that we can very quickly move into mid-range overpressure. So now we've gone on to prone on elbows, and then we can transition into overpressure even into a full extension or press up. The versatility of this is nice because we can do this from a sitting or a standing position also. So if we do not have some place to lie down, the way that the product is designed is that the strap hooks around the foot. And again, we put the belt at the correct segment that we want to be mobilized. And we then can extend backwards or do breathing techniques, which provide, again, overpressure. The previous slides were all really looking more in terms of extension-based exercises. We do have flexion-based exercises, double knee to chest, single knee to chest. There are multiple other exercises. I'm not going to go through all of them, but again, they're providing overpressure over that spinal segment that's needed. We also, if there is a lateral component that's desired, side glides and lateral components can be added. This can also be done in both a loaded standing position or an unloaded lying down position, roadkill positions, etc. And then we move into the mobilizations, and this is where it gets pretty neat also, pretty exciting stuff. We can do grade 1 and grade 2 mobilizations just by pumping the ankle up and down. So by movement of the ankle, we can actually start to mobilize the spine in these positions. Okay, so we can get onto our stomach and start to perform some prone exercises, mobilizing a spinal segment that's either stiff and or painful. And so we can do it for both mobility and pain relief effects. You could also throw in some deep breathing techniques. Obviously, as we move into deep exhalation, the spine naturally extends, and that would allow the spine to actually extend right at that spinal segment, again, mobilizing that segment. So a lot of really neat stuff we can do here. Again, now moving instead of at the beginning of the range of motion, we're now going to be moving into the mid-range motion. We can do this into a prone press up also. So lots of different areas that we can mobilize the spine. And then we can do this also in a standing position. So you can see here again that the individual is positioned with the ankle strap anchored to their foot, and as they go up onto their toes, it naturally makes the spine extend, and then it will actually extend and mobilize into that position with a posterior anterior mobilization. We can start to incorporate other familiar stretches that people do in the clinic all the time. This is an example of a cat camel stretch where we can mobilize into flexion extension for range of motion, fluidity of movement, etc. These are excellent examples of how we can take old exercise, modify them, and make them and improve them to help mobilize things. From an instability standpoint, there are quite a few options. Local and global muscle groups, abdominal bracing progressions, plank progressions, multifidus. I'm going to move through these fairly quickly, but you can see you've got plank progressions that we can do that will help to stabilize and add a little bit more resistance. Multifidus, there are several exercises where you can do it both stabilized with our entire plank or our entire core and body all the way across the bed, or unsupported, which would be much more challenging. Bridges, there are options for bridging. Quadruped position, strengthening all the muscles, erector spinae, etc., on the posterior aspect of the spine. And then there are lower level core stabilization exercises all the way up to higher level core stabilization exercises that we can start to incorporate. From a posture standpoint, let's say we have a discogenic patient where posture is extremely critical in terms of monitoring. The elastic bands that actually attach to the belt itself can strap and hook around one's knees when in a seated position. This then provides a posterior anterior push that will keep the spine in a lordotic position, which will allow to keep that spine in that stable position and allow to monitor pain, monitor posture, etc. So a lot of different options in terms of that. There are supine traction options and then prone traction options. So we can actually provide a little bit of traction and to provide some relief on the spine if that is something that a patient would respond to. The research obviously isn't always indicative of putting people into traction, but if someone is responding to that, that is an option that we have also with the belt. And then we have tissue lengthening. This could be muscle or nervous system mobilization. So quite a bit of hamstring stretches, IT band stretching, quad stretching, piriformis, moving into the nerve mobilization, nerve glides. You look at sciatic nerve glides with knee, ankle, hip emphasis, femoral nerve glides, knee, ankle, hip emphasis. So lots of different options that we have to allow individuals to really be able to take control of their pain. Gives them a lot of different options and strategies depending on what their problems are, whether we're talking about sciatica, discogenic issues, stenosis, DDD, instability, etc. So we're really excited over here to be a part of what you guys have going on, and very excited to be a part of this group. But you know, it's we've got, as always, we always have a lot of work to to keep pushing our profession forward. So that's kind of a general overview of the invertibelt system. Be happy to open up to questions. I don't know if there's time in this segment. I'm not quite sure what the schedule is like today. So, but in terms of what I'm presenting, that's about all I've got.
Thank you, Andy Champion. It was indeed a great presentation. If I request the viewers, if anyone has any doubt regarding the same, you can contact us. And now I would like to introduce our next international instructor, Dr. Davis Coe. Dr. Coe is a sports and orthopedic physical therapist with over 22 years of experience. He earned his BS degree in physiological sciences from the University of California at Los Angeles, as well as his master's and doctor of physical therapy from the University of Southern California. I request Dr. Coe to speak few words about your expertise. I welcome Dr. Davis Coe.
Okay. Thank you. Thank you for having me. It's a great honor to be with this group. And thank you, Gopa, for the invitation as well, and the organization. I am a lot like Andy in the sense that, and I'll go into that, but the first one is I'm not too tech savvy. So the first challenge will be to share the screen. So I'll try that. Well, can you guys see this?
Yes, Davis.
Okay.
Yes,
All
Dr.
right.
Davis. Yes.
All right. And just hit the play something. Okay. How do you get to the play section? I don't know how to even expand. I don't even know how to expand the screen. Let me just see if these even just work anyway. Okay. Okay, so I apologize. Not sure how to maximize the screen, but okay. Okay, so I'll just kind of just bear with me on this part. I don't want it to take too much time. Okay, so again, what is joint thrust techniques? I kind of wanted to show an example real quick of a patient that was diagnosed with adhesive capsulitis, frozen shoulder, for about 6 months. And you'll see her reaction, trying not to be able to get up in her arm, stuck at about 90 degrees abduction. And then I'll do a joint thrust techniques, and you can see if there's improvements in that through this. Okay, so here she's doing an upper cervical. So she got surprised by the noise, not that she was surprised by the technique, but more by because the inner ear is it's very loud when you do an upper cervical like a C0, C1. So, you see the left is not really going as far. No? She wasn't in pain. She was just surprised by the noise. So, In the beginning, there's not that much improvement because I think her brain is not believing that it can go any higher. So I encourage her to keep pushing. Okay. So that's one example where someone with 6 months worth of therapy at another place, and that was my first time seeing her, and seeing through my evaluation something was going on at C0, C1, C2. And so just like Andy was talking about, they need bang for the buck. They need, in this day and age, especially with people, if there's not enough time, especially on the sporting field, if you're on the sidelines and something's just not right with their shoulder, they need to get back into that championship game or at the Olympics, or someone that just can't afford a lot of treatments or that just don't have a lot of time. You need the bang for the buck for the community or for the sporting field or for whatever issue, whether in this country with certain insurance issues or worldwide, that to accommodate. And so if it's fast, efficient, quick, those are all things that you just can't get better at, and that's the goal, And so that's one example. And just like I believe that the role of physical therapy or rehab needs to have that mentality, you don't reward. I think before it's very like time based. Oh, we need a lot of time, and the more time you give, the better you are as a therapist. And that's really kind of I don't really find that the efficient world that we live in, where you don't reward a surgeon for doing an extra 2 hours of surgery to repair your ACL. It's actually the opposite. If he can repair your ACL in 30 minutes or 20 minutes and get in and out and do it really well, then that's the goal. Or a dentist pulling your teeth and trying to pull your teeth out of the cavity for 2 hours versus someone who can do it in 30 seconds. I think you'd want the one that can do it in 30 seconds. And so I believe that rehab, physio, occupational therapy, chiro, whatever it is, athletic, that we need to get faster and not slower, and get bang for the buck like everyone's talking about. There's a little bit about me. They already talked about it, so I don't want to get into that again. And these are some of okay, we don't have to get into it, but again, just the idea, just that understanding that no matter where you are, some time, like I said, or like the Olympic teams, it's time sensitive. Something's really hurt. My knee is really hurt. My back is really killing me. Is there something fast? Because I have my competition or my meet in 2 hours and I need something right now. And same thing with concert tours. They can't stop. They can't stop the concert tour and allow them to just get rehab. They need something right then, right now. Okay. Okay. So these are okay. So this same thing. All right. So common questions that I see. So the how accurate are we? Where are the cracks coming from? How many cracks do you need? So there's a lot of research of where, and a lot of times it's depending on the junction or the area, like the CT or the upper cervical or lumbar, that uh, where you line it up. Latest research shows that you're not really as accurate. Sometimes the pop is actually happening on the opposite side of where you're thrusting. And so there are some talks about why we need to do it bilateral, even though it might not hit the just the intuitive count where you're going into CT this way and you're thinking it's here, but the pop might come out that way, the cavitation. How many cracks do you need? So some people back in the day, you hear different things. Some people need it at least 3 or 4. Some people just say, if you're really good, you can get 1. And then we're seeing that it's not about being that accurate. A lot of times they're not that accurate. You also kind of need a range on that as well. And how fast is it to accurately hit the one that you're actually getting? You actually need a range of segments and not hone in on one per se. How fast is the mobilization? It should be very quick, and we'll get into, and people don't realize that as well, especially the newbies trying to get into the grade 5, which is a nice springboard from the grades 1 through 4 that Andy was talking about. And preload force, and we talk about the cavitation, non-cavitation. Can you get therapeutic benefits from the without having the cracks and pops? Can you? And there's a lot of research, one for one or the other. And for me, I just said it depends. Maybe that was just enough to untoggle the joint, maybe, and without the cavitation. Some people are adamant you need the cavitation to get all the neurological benefits, the inhibition, this, that, or the other of the muscles around it. And so, but it's always, for me, it's like, it depends on what that patient, what was that real need in there that was going on. And so, so the debate's out on that, and the biomechanical versus non-biomechanical. So a lot of times in the past, there's also still that debate that's raging where do you really need to get into the biomechanical, limitation, sideband, the rotation, extension? And is that the area on the right? And that's where you need to thrust. And if you don't do it in the biomechanical limited area, then you're not really getting it. Versus they say, if you just untoggle it, you just shake it apart, just kind of like you hit your TV and it's not turning on, the battery's not lined up, so you just hit the remote control on your hand and it just gets back into normal, and then you turn on the TV. So that's more the non-biomechanical approach. So there's still some debate on that, again, from respected people left and right, osteopaths, physios, chiros on both sides of the table, just talk, both PTs and debating each other on that, and osteopaths debating each other on that. So I would, from my experience, I think, again, it'd be patient specific. So maybe they need that biomechanical right at the end range of limited end range, or the remote control factor. And I see both. So I just wanted the effects. I just wanted to see the change like you just saw in the lady, and that's all I care about. I don't care if it was, and maybe I will go the opposite direction. Maybe I will just go for a general, they limit inflection, I go into extension, and they get better. They get better in their flexion. So so those are the things. JTT versus other treatments. I would also say that it's not necessarily better. It just has its place, just with anything else. No one thing is going to be absolutely superior. The only time a technique is superior is based on the patient. If the patient needed that one technique, then that's why it's superior for that patient, and not that the technique is superior, that it was superior for that particular patient. And that's why there's so many other things that can get better, and it's very patient specific. And for those that say that their technique is better than anyone else's, I just have I don't really go by that. I respect that's their opinion, but I'm more of, this has its place, and it's only superior if it's superior for that patient that needs it. And the example that I give for people that don't understand that is, I have people that have lost 30 pounds on a vegan diet, and then some people have lost their 30 pounds eating bacon and meat all day. And so what's better? You know what I mean? What works? Well, they both work. So it depends on the patient, whether you have a vegan diet, a Mediterranean diet, antihistamine diet, anti-inflammatory diet. It all depends, you know. And so low carb, high fat, low fat, whatever. Okay. All right, so here's some of the advantages. Again, one is the quick treatment time in any situation. It could be a good adjunct because you can just add it on to your to whatever else is going on, and then you can, or as a standalone treatment that you just saw. It's a great equalizer. So learning this technique, so a 5'1", 100-pound physio can do a manipulation like the one you just saw on Shaquille O'Neal, who's 300 pounds and you know, 7'1", and so it's a great equalizer when certain techniques are just very hard. If you're doing a soft tissue technique or a massage technique, and it's just the person is 320 pounds and you are much smaller, it's very taxing. So this is a great adjunct and a great equalizer between the operator and the patient. The psychological. Now, again, there's nothing wrong with that, because if that psychological barrier is keeping them from getting to their sport, or that they've had a good experience in the past, or and they feel that they just need that. And if you know athletes, especially professional athletes, a lot of them, many of them are very superstitious. A lot of them have their exact same routines to get ready. And this is one of them, then if you don't do it, they don't feel like they're really ready inside. So being able to pull that out. And again, a lot of athletes tend to have gone through that, either look for that in some form or fashion. And like I said, it's a good adjunct to any treatment because it doesn't take that much time. So it takes about a minute. So why not? And it adds things. And then you'll see immediate changes. So if it works, it works. If it doesn't, then move on, or allow it to work over another 24 hours along with other things. Okay. Here's just an example, number 2, real quick. And this one is with a former NBA player who played in the NBA for about 13 years. He's coming in with a shoulder injury. And so same thing, he's been suffering but this one he was suffering for about a year. He just didn't, from a tricep weightlifting accident. And for about a year, he was trying to rehab it on his own. And finally, it just kept getting worse and worse. And so this is him. And I'll be doing different techniques that you'll see, not only the CT upper cervical, but then I'll be moving down to thoracics and even AC joint. Okay, so here's that example. And just the big thing is, like, the takeaway that you want to see is their face, their reaction afterwards. And hopefully this will work. So he's in a lot of pain. He's a very strong man, but he's fighting through that. He's really, you can see his face. So now I'm going to CT junction. So his face isn't cringing to lift up his arm, right? He still has something else going on. So he still has a few issues. I'm going to look at something else for him. So he has pain when he, so that traditional position, you have to learn to have modifications. This is my modification. This is AC joint. Uh, I front staff added the music. Okay. So on going on top of that, just remember the one of the other principles of the JTT that I subscribe to is there's some older methods where like an Australian method where they would take you to the full end range and get you to the other end range of rotation and then extension and then just go for it and go. And that's not what you want to do. Actually, it causes more problems. And that's where those risks of when you get out of their anatomical range, when you put them into that severe position, or if you do a major whip, you see some older schoolers, they'll just get a rapid whipping versus it's quick. So you see that I did quick motions, but not a very like whipping or just a violent. And you see, especially on the AC or CT junction, it wasn't very violent. I just try to get into the space where I feel restriction come out of the space. And then you just go into the space again without putting themselves in danger. That minimizes those dreaded vertebral artery damages, tears, the extreme uncomfortability, and those bad reports when people have had those in the past. And again, the worst one is obviously stroke and death, which can technically happen, and if you're not careful with their background or your technique itself. So learning to manipulate, and then which also, because you're in space and you're not getting the benefit of just really getting that full end range, that you need to have that technique where you can be as gentle as possible, and create a therapeutic effect on for the patient, and position them as gently as possible, make the patient as comfortable as you can, make yourself comfortable as you can, and go for it. The other thing I would also say about joint thrusts is having different options. So some patients can't lay on their back. It's hurting too much on their back. Okay, well, what's another technique can you do? What are the sitting ones? What are the gentle sitting ones? What are the gentle standing ones? What are the gentle on the floor? You don't have a table. A lot of times in sports, you don't have the luxury of a high-low table. So what do you do on the floor? How do you do it prone? How do you do? So you should have all four ways of doing things, 5 ways of each sector, and to understand their importance, and then the dangers of when patients do it themselves and what's actually happening when they do that. So yeah. And that's about it. I just kind of wanted to just get into what I tend to teach at my courses, at least for the the joint thrust techniques, just the importance of making the patient comfortable, seeing benefits that can happen instantaneously. Uh, and it might be the missing piece if things aren't going the right way. So it's a good adjunct to whatever else that you're doing that was doing good, but then maybe hit a wall, and then maybe this will take you the rest of the way, or maybe that's the one that takes you all the way or takes you halfway, and then maybe the rest of your techniques that you learn will help you get the patient to where they need to be. And again, if for some patients can't afford a lot of treatments, they can't afford 6 months worth of physiotherapy, then if you can only give them one thing, I think that lady was, she was very happy. And then giving her a good home exercise gave her a big boost up. Um, if that was the only time you could see her, or if you can only see her 3 times, if you can do that, and for those patients that would benefit, then that is, I think, would be a game changer, and it sets a lot of authority for some patients because they instantly see an authority that you know what you're doing, and they saw the change. There's that trust that instantly builds up versus something that may take a month, 2 months, and then they, see some change. That still builds authority, but you know what I'm talking about. And I believe that's it. So if there's any questions or anything, I'd be happy to answer. If I went over, then just email me the questions, or and hope that helps. Uh, I'm all done.
Thank you, Dr. Davis, and for the wonderful presentation. And if any of the viewers are having any questions, please contact us directly. We will be forwarding it to Dr. Davis. And thank you, Dr. Davis, for accepting our invitation to be a part of GK's Master Technique, and looking forward for more wonderful workshops coming ahead.
Oh, okay. Thank you so much. I appreciate it.
Yeah. I request Dr. Anil. Dr. Anil, I hope you are free right now.
Yeah.
Yeah, Dr. Anil, to speak a few
yeah.
words. He is the principal of College of Physiotherapy, Dayananda Sagar University, and he is also the advisor and chief instructor of GKS Master Technique. So, Dr. Anil, I would like you to speak few words.
Thank you, Ranju, for the thing. Am I audible to all?
Yeah, you are audible.
Yes, Doctor.
Yeah. Thank you. Thank you all. I mean, I'm indeed privileged to be part of this team. And when I have seen through, you've got such a great panel. Hats off to Gopa to have assembled such great people who are individually masters in their own technique. And I think rightly you have named it masterclass because you have super masters with you. I mean, this course going through, you're going to deal with anatomy, biomechanics. I think that is our very fundamental basis. When I listen to these two foreign speakers who have spoken to us, international speakers, all of them have a lot of anatomy and biomechanics which we need to understand. I mean, there's a lot of classes that is going to happen on physical agents, both in heat as well as cold thermal agents is also going to play a part. There's going to be a technique of assessment. I think that is the most important part in physical therapy right now. You need to assess, find out what is wrong, and then treat accordingly, which will give wonderful results to the patient. I mean, that's what I saw what Mr. Davis and Andy had done, where you're reducing the treatment time maybe from weeks to a few days. So that's what physiotherapy does in wonders. I mean, the inverter belt, which is something new, new concepts that are coming in, right? You have the aqua techniques that are coming in. So I think all those who are joining these masterclass, we have wonderful speakers who are authorities in that, who are experts in that. Now, physiotherapy being a competency-based profession, where the skill enhancement techniques are going to come in, I think Gopa and Ranju, you have done a wonderful job to have selected such speakers, and I'm honored and to be part of this association so that which can help me. I mean, listening to these two lectures itself, I have already learned there are so many things that which I don't know, which I really need to learn from you all. Thank you all for being part of it, and we wish this to be a great success. Thank you. And we welcome all international speakers and national speakers on board. Thank you.
Thank you, Dr. Anil. Now I would like to introduce our senior instructors of GKS Master Technique, Dr. Ankit Bhargava. He is Masters in Musculoskeletal Disorders and Sports Physiotherapy. He has 12 plus years of extensive experience in clinicals, academics, developing various curriculums, sports and research, and more than 20 international certifications, also serving as chief editor in 3 international journals, India's first adventure sports and industrial physiotherapist, and he is also the founder and director of AB Healthcare. He has also written a couple of books and novels and recipient of various national and international awards, including presidential medals. It's, Dr. I would like you to speak few words.
Thank you, Mrs. Ranju, ma'am, and I welcome you all as a speaker, as a instructors of this GK Master Technique. And basically, I'm just a part of the instructor team, and also my basic role into the next step of launching of our magazine. And thank you, Dr. Gopakumar, for wonderful this kind of initiative we really require in the market, and so that people will get the benefit of out of this, and they can improve their skills. So thank you so much, and I am really privileged to have so much of learned people to attach with the learned people, and thank you once again for making me the part of this launch. Thank you.
Thank you, Dr. Ankit. Now, I would like to introduce Dr. Sharmila. She's not available today because of her personal reasons. She's a BPT, MPT, pediatrics, certified ocular neuro rehabilitation therapist. She is certified neuro manual therapist, and she's the director of Indian Ergonomics Healthcare, physiotherapist at Pondicherry Q Sports Association, Pondicherry. Now I would like to introduce Dr. Anjali. She's present today. I welcome you, Dr. Anjali. She is a consultant physiotherapist, lifestyle consultant, heart manual facilitator, women's health specialist. I request Dr. Anjali to speak few words.
Hello, good evening. Congratulations, Dr. Gopa and the whole team behind the launch. And it's a very exclusive platform where we've been learning such expert techniques from all the experts from all around the world. And congratulations to all the members here, and we wish you good luck today.
Thank you, Dr. Anjali. Now I
Thank
would like to
you.
introduce Dr. Divyendra Narayan Prasad Bid. He is MPT PhD, Senior Lecturer, Sarvajanik College of Physiotherapy, Veer Narmad South Gujarat University, Surat. I request Dr. Deb to speak few words. Divyendu, Dr. Divyendu. Welcome, Dr. Divyendu, to Master Technique, GKS Master Technique. Sir, you are not audible. We can't hear you, doctor. Yeah. So we can't hear you. Have you connected with the audio?
Can you hear me?
Yes,
Hello.
now we can hear you, sir.
Okay. Thank you, friends, for inviting me to this team. And I'm practicing spinal manual therapy, and I'm practicing high velocity, low amplitude thrust, which I teach all across India. And in this course, I'll be teaching about HVLAT, high velocity, low amplitude thrust for the full body, spinal as well as peripheral manipulation. Thank you. I hope it will be a wonderful experience with all of you, and we can deliver something good to the audience. Thank you very much.
Thanks a lot, Dr. Dibyendu. It was indeed a
You're
great.
most welcome. My pleasure.
Now, Doctor, I would like to introduce our academic coordinator. He's Alpesh, sports scientist and exercise specialist with a demonstrated history of working with a variety of athletes on different levels, playing different sports, skilled in exercise prescription, injury prevention, strength training, fitness training, and performance enhancement. Graduated in BSc Honors, Sport and Exercise Science from Sri Ramchandra Medical College and Research Institute. Focus on the main principle of life, basics first, areas of interest, high performance sports training, rehabilitation, integrated performance training. So I would like request Alpesh Jadhav to speak few words.
Hi, hello there, everyone. So, congratulations again, Dr. Gopakumar, about the master technique. It has been like a very long time. We're looking for this movement actually. So, and yes, actually, I'm going to talk about in this program about like foam rollers and what is like importance of the same. And I'm looking out for the more support from all of the staff and looking out for the more knowledge from other staff also. And thank you so much.
Thank you, Alpesh. Now, even academic coordinator, even Dr. Sharmila is an academic coordinator. Dr. Kapila Jain, next, assistant professor in DGU University. She is HOD at Urmila Hospital, Ajmer Road, Jaipur. She also writes articles for Adarsha Chirag newspaper. Is Dr. Kapila available right now? Okay, we move on to the next. Our technical support, Mr. Siddharth Khan. He is a product manager, gate-on motion analysis system, certified in running gate analysis, involved in 30 plus research and clinical projects on biomechanics. I request Mr. Siddharth to speak few words. Mr. Siddharth, I think you have not connected your mic. Okay.
Dr. Siddharth, you are not visible.
I think he's not there right now. Let's. There is one more instructor. I would like to introduce her. Her name is Shanmuga Priyanka, sports and exercise scientist. She has done FIFA diploma in football medicine, IHFA course coordinator for Chennai, certified instructor of CAD. I think she is also not available right now. So we will move on to the next launch, the launch of Active Athlete, the virtual e-magazine, the wonderful magazine with Dr. Gopakumar's Another Dream. So I would request Dr. Gopakumar himself to speak a few words about it. Dr. Gopakumar, he is the founder and editor-in-chief of Active Athlete. Dr. Gopakumar.
Hi, everyone. Yeah, back to the launch of e-magazine, virtual magazine. So the main aim of this is to bring much more education and towards knowledge sharing towards professionals and athletes so who works in the sport fraternity. So that's very very much needed, and especially when we are trying to give much more information. Athletes are losing, they don't get their information what they want towards any kind of recovery post injury, or they need to know about their status of their performance, or whatever, whatever which affects their athletic career. So a kind of knowledge sharing towards magazine, towards athletes, and of course professionals who work under sports fraternity, which includes every profession. So they also have to get much more knowledge, and of course a kind of icon of publishing articles, and spreading the awareness. That's the main concern. So my initiative of doing this was exactly to spread the awareness, and with all the experts coming into one roof, and publishing their articles, contributing themselves towards this article, and spreading awareness towards the athletes and the professionals, and upcoming graduates who have the passion towards sports. So that's the main concern. And yes, so today we are here to launch, and of course our panel members would let you all know about their vision, and how we are going to contribute much more better. Thanks a lot. Yeah.
Thank you, Dr. Gopakumar. Our editor-in-chief, Dr. Ankit Bhargava, would you like to speak few words?
Thank you, Ranju ma'am. I, being a editor-in-chief of this wonderful magazine, Active Athlete, one-stop magazine for professionals and athletes, welcomes you all to the historic launch of this unique magazine. I am thankful to Dr. Gopakumar from the core of my heart for taking this initiative and providing me this opportunity. And also give my sincere thanks to Ranju ma'am for being a wonderful creative director for our magazine, and to all the advisors, wonderful advisors, learned people, and I'm sincerely thankful to them. They have joined us as advisors of this is the magazine, and the editorial board members, junior members, and the student editors for being the part of this magazine. I hope our collective effort will make this magazine useful to everyone, and one day it will touch the sky and recognized all around the world. And as you know, Dr. Gopakumar has explained you what this magazine is all about. But basically, our mission is to make everything at one place, so that people will publish their researches, people will write their articles, people can learn new techniques and new stories about their performances. So that it will be, in short, it will be a beneficial to all everyone, those who are professionals or a layman person, and they will get the good things to read. And that's what I end my speech with the one quote of Herman Melville, said that to produce a mighty book, you must choose a mighty theme. Thank you so much.
Thank you, Dr. Ankit. It was really great to hear from you. Next, I would like to introduce myself. I am the Deputy Editor and Chief Designer of Active Athlete Virtual e-magazine, and I have been in association with Sport Physio from last many years, and I had been supporting Dr. Gopakumar in various ways in designing various posters, videos, and everything. And I will be the editor in chief. I will be the deputy editor and chief designer for the Active Athlete, and I am really honored to be a part of it. Now, I would like to introduce our advisory board members. Mr. Dev Arora, the president of Sports Academy Association of India. I would like you to speak few words.
Yeah, thank you very much, Ranju. That you are not an ordinary power behind this magazine, you are a superpower behind this magazine. So we all have to clap for you, because these all things, what is our imagination, you converted into reality. And really, I must congratulation and give my billions of wishes to all mega minds behind this matches. See, right now the time is 9:10, or exactly 9:08. So we all are working for creating an environment for the sports person, because after the injury, many of the sports person they forced to leave their career. I'm able to see the smile and confidence of Dr. Gopakumar, Dr. Ankit, and my warm wishes to our international speaker, Davis, and they deliver a fantastic talk on this platform. And I am able to see the big musketeer of the Murli Dharan. Hello, sir. Big namaste to you. And happy to see that the every age group are working to creating the sports environment for youth of world, not only in India. And plenty of things we are developing from last 4 5 months with the association of CASS and his team also. So we no one can stop us to make a golden opportunity for the youth. So youth, you all are welcome. Youth, entire world, now we are ready to pouring a red carpet to all of you. Do hard work. Our sports physiotherapists, they all are with you. Don't worry about injuries. We will taking care of you all. And really, we become a first one, this big association in the world who is caring about the entire sports person. So big, 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 big clapping to everyone. Big limbs of wishes to everyone. Then join together. We can make a good, healthy, happy environment for the sports. Thank you very much.
Thank you, Dave. Now, I would like to introduce our next advisory board, Dr. Vipin Kumar. He is the CEO at IHFA, International Health and Fitness Association, Delhi. Is he there, Dr. Vipin? I think he is not there. Now, I'd like to introduce Mr. C.K. Muralidharan. He is an experienced sports specialist with a demonstrated history of working in the sports industry. He's skilled in sports journalism, sports development, and event management disciples. And he is a freelance sports journalist. I request Mr. Muralidharan to speak few words.
Congratulations, Sri Gopakumar, on this excellent initiative of starting this active athlete and GKS Master Technique. On behalf of him and everyone on board, I'm extremely happy that we can contribute our might and share our knowledge with each other, and also to people on different aspects of sport and sports medicine, and professionally with such people on board. Congratulations everyone on these excellent initiative by Mr. Gopakumar, and hope in the days to come we can reach many people with this initiative. Thank you.
Thank you, sir. Now, I would like to introduce Mrs. Radha Krishnaswamy. She is a strength and conditioning coach for national women cricket team from 2016 and 17, and she accompanied them to the World Cup in England 2017. She served as strength and conditioning coach of Mumbai under 19 girls team in 2011-2012. She is a certified strength and conditioning specialist, and she is an instructor of CAS. Mrs. Radha Krishnaswamy, are you available? Okay, I think she left due to some emergency. Mr. Siddharth, are you available?
Yes. Hi,
Yeah,
I'm available.
yeah, I had actually introduced you quite some time back in GKS
Okay,
Mastertechnique.
okay.
Can you speak few words?
Yeah, absolutely. So thank you first of all for having me here and giving me a chance to speak. I'll quickly introduce myself. So my name is Siddharth Hans, and I am a product manager of Gaton, which is a motion analysis system. And in terms of qualification, I'm a certified gate analyst. I have an engineering background specializing in biomechanics. So this is what I've been pretty much doing, pretty active in the field of biomechanics. To be more specific in terms of walking gait analysis, running gait analysis, posture analysis, and all other sports specific assessments of patients. And in addition to this, I have been involved in around 30 plus projects in biomechanical analysis. So hope I can add
It's
some
not much
value.
clear,
So
Siddharth. Can you be little loud?
yeah, is the voice audible now?
Yeah, okay.
Okay, so I've been pretty much involved in the field of biomechanical analysis. Around 30 projects I've been involved at research and clinical level. So hope I can use some of my expertise and contribute to this wonderful initiative that has been started by you and Dr. Gopakumar and entire core physio and CAS team. So again, thank you so much for having me here.
Thank you, Mr. Siddharth. Now I'd like to introduce Mr. Arun. He is the founder and CEO of the Training Lab Sports Performance Center, Chennai. He is a certified strength and conditioning specialist, National Strength and Conditioning Association, Colorado Springs, USA, functional movement screen specialist, scientific core conditioning specialist, Czech Institute. He is also is he available, Mr. Arun? Okay, I think he's also not there. Now I would like to introduce our editorial board members, Dr. Swapnil May. He's what is
Ranju, I wish to introduce one of our strategy president. He's from Hughes, Mr. Neeraj.
okay, hi.
If you permit me, then he can
Yeah,
share
please.
his wishes to all of us.
Yeah, please.
Mr. Neeraj, please.
Mr. Neeraj, we welcome you to the launch.
Oh,
Yeah.
thank you. Yeah,
Yeah, Neeraj. Yeah, please.
thank you very much, Dr. Dave. I mean, I'm speechless. Honestly, blessed to be a part of this eminent people and joining today's session. Just give me one thought, and I'm sure that someone would have already heard about it. These are a few lines which have been written by Steve Curley, and it says, "The greater the challenge is, the greater the joy is in overcoming it. Never let anything or anyone stop you from fulfilling your dream." I'm
Yeah.
thankful to speakers, contributors, and especially Dr. Gopa for her self-proclaimed wisdom for making this happen. Thank you very much, all, and I enjoyed the session thoroughly.
Yeah. Nice. Thank you so much.
Thank you, Mr. Neeraj. It was indeed pleasure having you here. And thank you a lot for your wonderful wishes. And next, I would like to introduce Dr. Swapnil May. Swapnil, he is an editorial board member. He is also going to be there for the upcoming Tokyo Olympics in 2021. He was also there for Rio Olympics 2016, London Olympics 2012. And next, I think so he is not available. Our editorial board members are Dr. Swapnil, Dr. Kapila, Dr. Sharmila, Dr. Alpesh, and Ms. Priyanka. Dr. Alpesh, would you like to speak anything regarding active athlete? Are you there? Okay. Next, Dr. Gagan, I would like to introduce Senior Resident in Department of Physiology, AIAMS, Gorakhpur, UP. He is ex-medical officer. He is also a part of our editorial board. And our student editor is Ms. Ananya Sinha. This is our team of active athletes, the virtual e-magazine. Now, Dr. Vipin was supposed, he said he will be joining us in 2 minutes. So, meanwhile, I would like to really thank each one of you all for coming here and spending your time, and also all our YouTube members and also the core physio viewers, as well as our all staff and students and all instructors and all well-wishers of core physio. And this GKS Master Technique, please be tuned. Dr. Gopakumar, you would like to speak something?
So yes, so I think last but not least, I would inform everyone about the technique, GKS Master Technique, which is going to be launched from Jan 2021. So we'll keep you updated on the course contents and complete details of it. Meanwhile, Active Athlete 2 is what we have planned for the new year, and we will be coming out with a couple of, so those who are ready to contribute your articles, everything. So our whole technical team will be getting in touch with you. And so thanks once again, thanks to all the guest speakers, our patrons, our advisors. Of course, nothing is impossible without you all. So yes, I can only deliver, but yes, with all your support, it's really great. And I think yes, we will get into we'll fight the corona, and in 2021 Jan onwards is a new thing for us. Yes, so I think that's it. That's the whole thing which I would say. Thanks once again. Thanks to all. Dr. Dev, Mr. Muradharan, thank you very much for your all support. I'm being blessed by you all, and of course all my supporting team, right? Anil, John, yes, Anjali, Siddhant, Alpesh, Priyanka, Sharmila, Kapila. So yeah, all the names. If I've left out something, please, excuse me for that. But yes, the whole team. I would thank everyone who have come today and who have made your time for this. And I think yes, this would create a different way of execution. So we would bring in the best for everyone, especially towards the magazine and towards the technique. And thanks to our international speakers, Dr. Davis and Andy Champion. Thanks a lot. Thanks a lot. Of course, the timing here and there. Yes, you're getting into the work. We are getting into sleep. So, thanks a lot for coming in. And yes, we'll work together. Together we can. That's it. Yes. Thanks a lot. So I think if Vipin is not there, so I think
There was some issue in joining in previously.
I think so. So I think we can close this. Yeah. So.
So thank you
Thanks,
once
Dr.
again.
Vipin. Thanks, Dr. Vipin. Also, I think yeah, you made it a point to inform. So yeah, thanks a lot. Thanks a lot.
Thanks
Yeah.
to all. Thanks, Dave. Thanks, Vipin.
Thanks
Thanks,
a lot.
Monica. Thanks to all, one and all. Thank you.
So now everyone move to kitchen for a dinner.
I think
All right, sir,
sorry,
prepare it and enjoy it.
He's not able to. Mr. Vipin is there. He's not able to speak. I think so. He's written in a message here that he has been many times but unable to hear any voice. So he's typing here. So thank you, Mr. Vipin, Dr. Vipin, for being a big
Thanks a lot,
support.
Vipin. Thanks a lot.
Yeah, thank you, Dr. Vipin. I can't see you, but I can feel you, man. Yeah. Thank you, everyone.
Dr. Anil, you're there? Okay, Anil.
Participatory list. Yeah, so everyone move to kitchen, I think. All right.
Thank you. Thanks a lot. I will be
Good luck.
Wrapping up.
Thank you.
Yeah.
Thank you.
So nice
and
of you.
everybody's support for moving.
It's a beginning.
Yes, Dr. Ankit. Thank you. Thank you, Dr. Ankit.
It's a new beginning.